Записывай.
Ну да. Okay, let's begin our lectures. Today, our lectures about anatomy-physiological features of blood in different age, methodics of clinical laboratory investigation, semiotics of general hematology syndromes. Plan of the lectures includes one times repeat anatomy-physiological features of blood in different age during childhood, methodology of clinical laboratory investigation, semiotics of general hematology syndrome, anemia, hemolytic hemorrhagic syndrome. Blood is internal body environment that carries out many vital functions, such as respiration function, oxygen and carbonic acid gas transfer, protective function, humoral and cellular immunity, nutritional function, includes nutrients transfer, excretion metabolism residue, humoral transfer of hormones and biological active substance. Its main vital functions of blood. Blood is contained from two main parts, cells and plasma. Cells includes erythrocytes, red blood cells, leukocytes, white blood cells, and thrombocytes, platelets. Plasma is a fluid part of blood, includes many water and many solution of different substance. Erythrocytes, red blood cells, are cells without nucleus. Their lifetimes is only 12 days in early neonatal periods and 120 days in infancy and elder age. Please pay attention for it. Red blood cells in normal has a short lifetimes in early neonatal period, just only 12 days. And for another periods of childhood and in adults age, we have erythrocytes lifetimes just in average 120 days. Size of red blood cells depend of diameters in millimeters, meters. Divide to normal size, it's nearly 75% of all red blood cells, diameter between 7.1 to 7.8 millimeters. Macrocytes more increase size more than in diameter more than 8.0 millimeters. It's nearly 12.5% of normally. Megalocytes more than 9.0 millimeters in diameter, and microcytes less than 6 millimeters, also present in normal in our red blood cells components. Erythrocytes, red blood cells, you can see on these pictures, divided to normal sites and macrocytes. Erythrocytes, red blood cell content, red blood cells number in different age, different parameters, such as in neonate periods, especially early neonate period. If you remember, it's periods from birth to during first 6 days age, and red blood cells number in these periods between 5.4 to 7.2 in 10 and 12 degree per liter. In a late neonatal period, in average 4.07 to in 10 in 12 degree in liter. Its parameters of its normal parameters of normal. You must remember about it. Never another age period present these parameters such as red blood cells number, such as in neonate, especially early neonate periods. In infancy, the border of normal red blood cells number, you can see on this table, it's between 4.2 to 4.8, and elder than 14 years old, 5.2 to 4.8. Hemoglobin, fetal hemoglobin, F makes about 80% of total hemoglobin at birth, especially in cord blood, and about 20% of hemoglobin A, such as adults. Hemoglobin F is 75% of total hemoglobin for 2 weeks, the first 2 weeks of life. Hemoglobin makes 55% of total hemoglobin for 5 weeks of life and falls to 5% by 20 weeks of life. It's decrease and change from fetal hemoglobin to normal hemoglobin A. In table present a normal level of hemoglobin in different ages. Pay attention for early neonate periods. Just border of normal level of hemoglobin between 180 to 220 gram per liter, and decreasing late neonate periods up to 150 per liters. In each, especially first half of first year's life, its parameters may be less than less than 110 gram per liters. Elder than 5 years old, the normal level of hemoglobin, such as adult, 130 to 150 hemoglobin gram per liter. Pathological change, red blood cells and hemoglobin. If this number of these parameters decrease, it's named anemia, leukemia, and hyperhydration, such as reason of this decrease normal parameters. And if red blood cells and hemoglobin increase, the situation such as erythrocytemia, exocytosis, and cyanotic cardiac heart, chronic heart diseases. Color index is relative hemoglobin's content in what red blood cell. Its formula, how calculate color index in real situation. In normal, we have color index between, does except neonate period. In normal, we have color index between 0.85 to 1.05. Just in neonate period, it's increased and maybe up to 1.2. It's different between color index hyperchromy, color index over normal parameters, named hyperchromy, is color index normochromical, and if color index hyperchromy, if low normal parameters. The leukocytes, white blood cells, divided to granulocytes and agranulocytes. Granulocytes includes neutrophils, eosinophils, basophils. Agranulocytes includes lymphocytes and monocytes. You can see it parameters to neutrophils, granulocytes. It may be different variants of granulocytes. It's myoblast, promyelocyte, neutrophil, promyelocyte, and neutrophils. It's young form metamyelocytes, and neutrophil different variant. The leukocyte granulocyte divided to eosinophils and basophils. Name depend of how change color during specific change it. Leukocytes and granulocytes also includes monocytes and lymphocytes. The leukocytes amount is high at birth, rises slightly during the first 48 hours after birth, falls during the next 2 or 3 weeks, and then rises again. In some cases, it reaches its highest level in the life before the 7th month. Attention to leukocytes amount is high at birth. Its parameters may be very high that in normal at healthy children in another age and adult. In normal parameters of leukocytes in adult it's between 4 to 6 in 10 in 9 degree per liter. But just after birth, especially first 48 hours, its parameters between 10 to 30 in 10 in 9 degree per liter. You can see here in these slides, during the first few days of life, the number of white blood cells is high, about an average 20 in 10 in 9 degree per liters, and granulocytes predominate. Thereafter, the total number drops of range of 5 to 12 in 10 and 9 degree per liter, as a percentage of lymphocytes become equal to or greater than granulocytes, about 50–70% of lymphocytes. The shift back to a predominance of granulocytes does not usually occur until the age of 4 or 5 years old. About this cross between granulocytes and lymphocytes you studied at histology. The leukocytes, level of leukocytes in neonate and elder on these slides. Please attentively decrease of cells number less than 4 in 10 in 9 degree per liter, name leukocytopenia. If increase of cells number more than 9 in 10 in 9 degree, its name leukocytosis. The leukocytic formula includes if all leukocytes number 10%, basophils, it's in normal, just no more 0.5%, eosinophils in normal between 1 to 4%, monocytes between 6 to 10%, and all of this group in average 10%, neutrophils and lymphocytes, all these leukocytes number in average 90%. Its graphics variant cross between neutrophils and lymphocytes and neutrophils. In 5 days and in 5 years, it's cross between number of lymphocytes and neutrophils. The leukocytic formula neutrophils includes myelocytes in normal must be absent, metamyelocytes no more than 0.5%, band neutrophils nearly 3 to 5%, and segmented granulocytes each normal band neutrophils. If a number of myelocytes, metamyelocytes, and band leukocytes increase, this phenomenon named shift to left. You can see in these slides. Shift to left in leukocytic formula. Sometimes we have a different variant of change in leukocytic formula when miss some transfer variants of leukocyte in formula, and it's named hiatus leukemicus, провал, лейкемический провал by Russian, hiatus leukemicus. Thrombocytes or platelets, there is a fragments of large bone marrow cells, megakaryocytes. The lifetimes of platelets is about 8-9 days. 8-9 days. Thrombocytes or platelets, normal number of platelets does not depend of age and sex. Its average between 1,050 to 150 to 300 in 10 in 9 degree per liter. Critical number of platelets, low level of critical. It's nearly 30 in 10 in 9 degree per liter. You can see these different in uterus, different age, and you can see when the hematopoiesis made during these periods of childhood, this stage of childhood. In uterus, in LH, it's wall yolk sac, and during all periods of pregnancy. In liver, make hematopoiesis. Spleen hematopoiesis between 12 to 20 weeks of gestation, and just from 16 weeks of in uterus, the bone marrow hematopoiesis start. Production of formed elements in blood occur primarily in the bone marrow. The liver and spleen retain the ability to make blood cells until early childhood at times of pathological stress such as excessive hemorrhage. Newborn. The umbilical cord is not clamped for 2-3 minutes after delivery of infant. 75 to 130 milliliters of blood will be transferred from the placenta to infant. Late clamping will produce number of red blood cells, which approximate hemoglobin level approximately 25 higher and hematocrit 70% higher than in LH clamping were carried out. It's important situation. The need for just early clamping of umbilical cord at newborn. For newborn also nucleated red blood cells and immature lymphocyte may be present in newborn but disappear within first week of life. At birth 5% of all red blood cells may be reticulocytes. They drop to less than 1% after the second week. Not in another age, 5% of reticulocytes content is normal, not just only at birth, and may be present in first 2 weeks of life. Up to 5% of nucleated red blood cells, such as percentage of normal number of nucleated cells, may be present normally for several days after birth. Up to 5% of nucleated red blood cells, nucleated, and normal is not that present. Normally, the number of leukocytes and erythrocytes and the amount of hemoglobin is relatively greater immediately after birth than that in any other times of life. System of hemostasis at children. About this system we will say about it after short interval. Please, a cup of coffee, please. You can have short interval. В аудитории, да?
Нормально. Да.
Ну, вот это аудитория, что да?
Я тут различил, куда делся.
Вот этот запущен же. Вот откуда он, где он?
Ладно, вы читайте, я пойду сейчас посмотрю. Где это?
Ага. Где эти аудитории?
Сейчас проверим.
Yeah, continue our lectures about system of hemostasis. There are three components of hemostasis system in human body. It's thrombocytes or platelets, wall of blood vessels, and elements of plasma. And according to these parameters, there are two stages of hemostasis. It's primary vessels thrombocytes hemostasis and secondary stage of hemostasis, it's coagulation hemostasis. Primary hemostasis, if discharge of component of grade of vessels wall, make arteriospasm, elimination of thrombocyte.
Нормально,
Да?
там у меня почему-то есть, у вас почему-то нет.
Есть там кто-то,
Да.
да? Ну, хорошо. Elimination of thrombocyte stimulation from walls of blood vessels. Adhesion, joining of thrombocytes and walls of blood vessels, and cell aggregations. Cell aggregations. And forming of clot of blood. Forming of clot of blood. Secondary hemostasis stage includes many factors which present in plasma. It's different bioactive components with and includes in different step by step making and hemostasis process, such as here you can see secondary hemostasis includes activation of different factors from step to step and make a specific process with final result of hemostasis. Methodology of clinical laboratory investigation. No, first it's complaints. Complaints according to blood disorder includes weakness, fatigue, dizziness, dyspnea, palpitation, fever, skin itching, perversion of tastes in eating chalk, clay, go, perversion of olfaction, the patient finds pleasure in smelling as a petrol or another substance with unpleasant odor. Burning feeling in tongue, susceptibility to hemorrhagic diastatic bleeding, pain also maybe such as complaint, pain in bones in the right or left hypochondrias and linings during swallow. It may be symptom of blood disorder. During inspection, we can make and check color of skin, pale of skin and visible mucus with different hue, alabaster, yellow, waxen, cherry red. It's a symptom of problems with the blood. Hemorrhagic spots on skin and mucosa, trophics of the skin and hair. It may be dry skin, brittle hair, and inactive. Disordotrophics of skin and hair. Mouth, atrophy of tongue, papilla, alveolar puree, necrotic ulcerous tonsillitis intact. Regional swelling on the neck and other areas. It's during inspection. During palpation, we check flat bones or epiphyseal of tubular bone, presence and tenderness during palpation and tapping. Palpation of a lymph node, location of different parameters of this palpation of lymph nodes very important. Location, size, tenderness, fusion with skin and conglomerate formation. In normal, not all groups of lymph node palpated. In normal, not all groups of lymph nodes palpated. Examination of a spleen, visible enlargement, border of a spleen are obtuse. Data of palpation includes size, consistency, characteristic of the age, sharp, obtuse, or surface, smooth tuberosis, tenderness, mobility while breathing. Different parameters of spleen during examination of spleen. General blood test we use during examination, laboratory investigation of blood. Biochemical blood test, coagulogram of blood, includes investigation of hemostasis parameters, analysis of sternal puncture, analysis of the urine, and X-ray examination. Semiotics of general hematology syndromes and blood diseases. Main general hematological syndrome includes syndrome of anemia, hemolytic syndrome, hemorrhagic syndrome, and leukemia. Syndrome of anemia. Anemia is a state with decreasing number of erythrocytes and level of hemoglobin. Reason of anemia, it may be different. It may be bleeding, post-hemorrhagic anemia, iron deficit iron deficit anemia, nutritional anemia due to vitamin B12 deficiency or B12 or folic acid deficiency anemia. Syndrome of anemia include family members maybe not have such syndrome, peak age, second year of life and repeat growth phase of adolescence, premature infants feeding with milk formula without iron, or early introduction of cow milk. It may be a risk group of syndrome of anemia. fatigue, lethargy, pale appearance, pallor, dry skin, brittle hair, bad atrophy of nails, tachycardia, tachypnea. All of these parameters may be present and say about syndrome of anemia. Syndrome of anemia. In blood test during syndrome of anemia, we should found hemoglobin mildly to severe decrease. Leukocytes are normal in number and appearance. Platelets are normal or increased. Erythrocytes are hypochromic and microcytic. Erythrocytes vary in size and shape. Different reticulocytes number decrease after treatment increase. Serum iron decrease. Total iron meaning capacity increase. Serum ferritin decrease. Complications may be predisposition to infection is due to neutrophil dysfunction and impaired absorption of fat. Vitamin A may occur. Complication, okay, it's very important for understanding what importance information about anemia. It's table you should remember for use during all and other periods of study, especially according to parameters of blood. We can change different degree of anemia by level of hemoglobin. The first degree of anemia, it's hemoglobin between 90 to 110. Second degree of anemia between 17 to 90 gram per liter, and third degree less than 17 gram per liter. It's need for understanding what may be used in treatment, different variants of combination drugs and specific treatment precision. Hemolytic syndrome. Hemolysis, a process of erythrocytosis destruction, is going out of hemoglobin. The reason of hemolysis is toxic substance, serious illnesses such as malaria, sepsis, severe burn, blood transfusion, and rhesus conflict. Hemolytic syndrome signs includes jaundice, pallor, paleness may be precede jaundice, splenomegaly, fever, dark urine, fatigue, abdominal pain. It's hemolytic. Next, hemorrhagic syndrome. Hemorrhagic syndrome is disposition to repeated bleeding, like after trauma and spontaneity. There are three groups of hemorrhagic diathesis: coagulopathy, hemophilia, thrombocytopathy, it's idiopathic thrombocytopenic purpura or Welgoff diseases, and vasopathy, and Chanel, Genoch, Purpura. 3 groups of hemorrhagic diatheses. Hemophilia causes of hemophilia: quantitative deficiency of clotting factors. It may be factors of 8. Hemophilia are most often situation. Factors 9 hemophilia B and factors 11 hemophilia C. Etiology: it's genetic. X chromosome linked men affected transmit from grandfather to grandson. Mother is a conductor. Hemophilia A and B autosomal dominate a type of genetic transfer. Hemophilia C, severe disease, it's autosomal recessive. Signs of hemophilia: exercise, bleeding after dental extraction, episodic spontaneous hemorrhagic into joints and other tissue, unexpected bleeding after surgery, deep tissue hematoma, particularly after trauma or surgery, excessive bleeding after the commissions, swollen, painful, warm joints, acute creeping joints, deformity, especially if situation is chronic. Activated or partitional cytoplasmin time, prolonged coagulation factor activity, measurement correlated with disease severity of hemophilia A and B, normal region between 50 to 150 units per deciliter. Less than 1% indicates severe diseases, manifest as spontaneous bleeding episodes, potential for joint deformity. From 1 to 5% indicates moderate disease. 5 to 20% indicates mild disease. Mild and moderate patients have post-traumatic or post-surgical bleeding. Schönlein-Genoch purpura includes purpura is essential idiopathic. Trigger includes the following: non-specific upper respiratory infection in nearly 33% of patients. Sulfanilamide or penicillin treatment, streptococcal infection. It's triggers for Schönlein-Genoch purpura. Epidemiology: Schönlein-Genoch purpura can occur in any age, but it predominantly affects children. It has a seasonal variation, occurring most often in winter months. For most patients, symptoms occur in 48 hours after infection, usually upper respiratory tract infection on injection, for example, antibiotics. Florid palpable puric skin rash, predominantly on legs, but also on buttocks and arms. Cardinal symptom: cramping abdominal pain for 60 to 70% of patients, joint pains for 60 to 70%, blood in urine or stool for 20 to 30%, symptoms of intestinal obstruction due antiception for less than 5% of young children. Fever and toxicity, if severe. Rash, pupilla purpura, lesions that don't blanch on pressure. Some form a necrotic center that may vesiculate, usually on buttocks, and extremities. Lower up, transfer to upper, usually painless, may persist or recur for up to 2 months. Joints in environment, mild to moderate symmetrical arthropathy for 60 to 70%. Some periarticular swelling. A few patients also have edema of hand and feet. And leukemia. Leukemia, the cause is unknown. Increased risk for development of leukemia associated with the following: Down syndrome, Fanconi anemia, Bloom syndrome, ataxia, telangiectasia, and immunodeficiency disorder. Symptoms. Many non-specific symptoms and related to bone marrow failure. Bone pain, fever, pallor, lethargy, anorexia, malaise, and due to bone marrow failure. Abdominal distension due to hepatosplenomegaly. Shortness of breathing. Facial swelling due to mediastinal mass unusual. Headache, vomiting due to central nervous system diseases. Full blood tests show pancytopenia or isolated raises in leukocyte number. For 50% of patients, leukocytes number is more than 10,000 per liter at diagnosis. Peripheral blood smear likely to show leukemic blasts. Leukemic blasts are one of the main symptoms of leukemia. Bone marrow morphology confirms diagnosis in conjunction with cytochemistry and immunophenotyping. Mature B cells, variated treated to lymphoma times protocols. Chest X-rays for mediastinal mass exam. Lumbar puncture for CNS diseases determined. Blood urea, nitrogen, creatinine, electrocytes, calcium, phosphorus, and uric acid to look for evidence of tumor lysis. Today we finish. Please, if you have some questions, print it here. Well, another question about this topic you should discuss during practice classes. Good luck for it. Thank you for your attention and good luck for you.